Good afternoon, everyone, and welcome to the American Heart Association's Introduction to Get With the Guidelines Stroke webinar. I'm Kristen Waller, Quality and Systems Improvement Director for the state of Arkansas and Texarkana, Texas area. I've lived in Arkansas my entire life. I'm married with 3 children, Madison, Hannah, and Eli, and I've been a nurse for 14 years with a background in ICU, interventional radiology, cath lab, cardiac rehab, and STEMI coordinator. My favorite hobby is ruining a good book with sand and salt water at the beach. Today's webinar will be focused on getting started with Get With the Guidelines Stroke Patient Management Tool, the new Arkansas form, and stroke bands. Just a reminder, all phone lines have been placed on mute. If you have any questions, please type them in the Q&A box. We will also give instructions on how to come off mute at the end of the presentation to ask questions. If you have dual screens in your office, and the ability to view the webinar and log in to Get With the Guidelines Stroke at the same time, please do so now. If you can't, no worries. This will be recorded and you can watch again later. Allison Capetillo will be today's webinar presenter. Allison is the Director of Quality and Systems Improvement for the Houston Gulf Coast Territory of the AHA. Allison graduated from the University of Texas Medical Branch School of Nursing in 2009 and began her nursing career as a nurse in 2010. Her clinical background includes orthopedics and neurointensive care. In 2014, Allison shifted her focus to healthcare quality and assumed the role of stroke program manager at her hospital. Her experiences working for a large comprehensive stroke center led her to the American Heart Association in 2016, where she has been able to combine her passion for data and process improvement in hopes of providing better quality of care for all patients. Outside of work, Allison enjoys traveling with her husband, Adam, and spending quality time with her toddlers, Knox and Maddox. I will now turn the presentation over to Allison.
Thank you, Kristen. So welcome, everybody, and thank you all for being on with us today during your lunch hour. We have some, I hope, really impactful information to share with you. And I hope that even those who are maybe a little bit more seasoned with Get With the Guidelines will find some value in what we can present today. This is, again, going to be an introduction to Get With the Guidelines, so definitely more tailored to our new users. And Kristen and I will both be sort of jumping in and out on this WebEx to share with you some of the pertinent information for Arkansas participants. So I'm going to, with that, just jump right into our topics of that are being covered today. The first thing we're going to do is just kind of get started and show you some of the resources on your homepage. If this is your first time logging in to Get With the Guidelines, definitely you'll be able to find some new things on the on the homepage that might be beneficial to you. Then after that, we'll move into the patient grid and what it looks like to enter a new patient. I will demo this live for you so that you can see step by step how to enter your very first patient. And then we will talk about some of the details of the Arkansas Form Group. If you are not familiar yet, Arkansas is doing a special initiative around stroke bans, and the Get With the Guidelines form has been updated especially for you guys. So we're going to just show you some of the elements that are unique to Arkansas. The next part we'll go into is some of the reports. We're going to show you just some very basic high-level reports that you can run for your stroke team and your hospital, and also to look at how you can benchmark yourself outside of your hospital. Then we'll move into what are called optional fields. If you've looked at Get With the Guidelines before and don't know what these are, this will be a great time for you to get some more understanding around what these optional fields can be used for. We'll follow that up with some managing of the code list, and I will explain more what that is, and we'll be providing a handout to you as well so that you can reference that later on. And then we'll end up the session with a section I like to call, Hey, I Didn't Know That. And these are some just things that maybe if you've been using Get With the Guidelines, maybe you've never noticed before. Just some little features that we like to point out so that maybe you can utilize them in your practice going forward. All right, so with that, I'm going to jump right into our Getting Started section. So the very first thing when you log in to Get With the Guidelines for the first time and you're on your homepage, this is sort of a snapshot of what you're going to see on the homepage. You've got sort of blocks that are broken up here into just different sections. Your Get Started is up on the top left, and we'll show you some more of the features in that in just a moment. On the right, you have a section under trainings that says stroke. And if you have not looked at this recording, I highly recommend that you do. It's a great tutorial. I think it's about 30 minutes long, so you can look at it through maybe your lunch hour or something like that. And just, again, it gives you a high-level overview of how to use your stroke tool. On the left, again, you'll see where it says My Hospital. You've got a block here that gives you some just information about when you started Get With The Guidelines at your hospital, how many patients you've entered to date, and then what your baseline date is. And this, you'll see two different dates. The AHA baseline date is when you signed your contract with us. The start date is when you actually started entering information. I would also like to point out on the bottom right, there's a circle there with a number that's a little over 5 million patients. I have not updated this in a couple of months, so I imagine it's a little higher now, but that is really cool. This is actually a live snapshot that I took a while back from one of our hospitals, and that actually is the number of records that have been entered into Get With The Guidelines to date over the last 15-ish years that Get With The Guidelines has been available. And that is just incredible to know that we have 5+ million patient records entered into this tool that are being used for research. I think that is just phenomenal. It goes to show how much can be, taken out of this database to focus our efforts on research and guidelines. So just really, really neat to see that and to know that your hospital is a part of that. And then last but not least, at the very bottom, you will see a box that says Get With The Guideline Stroke On-Demand Trend Reports. And I'm going to show you guys a little bit more on this later, but it is a really neat report to pull out every once in a while, maybe like once a quarter. So I will show you some snapshots of that as well. Okay, moving on. I promised you I would show you some more information about the resources on the Get Started section. When you log in, this is the view that you will see. You will have these little icons that you see here for each module that you are participating in. So if you see more than stroke, that means that your hospital is participating in one of our other modules as well. When you click on this little gray suitcase, or some people like to call it a file drawer, you will actually see this box pop up. And it's a box full of a bunch of links. I want to show you these because this is going to be where some of the most valuable information is kept for Get With The Guidelines Stroke. So when you open up that box, one of the very top things up here is coding instructions. This is going to be your Bible for Get With The Guidelines Stroke. And there are a couple of ways you can access this, and I'm going to go through that in just a second. But what I want to mention before we keep going is that if you have not put a patient into Get With The Guidelines yet, or if you're still in the early stages and are still kind of struggling or trying to understand more about these different data elements, I highly, highly recommend that you at least take some time to familiarize yourself with the coding instructions. They are a little bit tedious and they're quite lengthy. I would not recommend that you print them out. They are, I believe, 300+ pages. It's a very, very long reference guide, and it changes probably once a quarter. So it's not necessarily worth printing out because it's going to change so frequently. However, I would bookmark it on your computer so that you can get to it fairly quickly, or you can always access it from within the PMT. And I will throw that term around a lot during this WebEx. The PMT stands for the Patient Management Tool, and you'll see that throughout our presentation here. So with that, we're going to kind of move into how to navigate through the coding instructions. 2 ways to access. Of course, you can do it through the spot that I just showed you in the resources block here, or you can do it while you're in the actual tool entering a patient. Say you're entering a patient and you have a question about how to answer the question that's in front of you. You can click on the blue hyperlink that's in the section that you're on, and it will take you directly to that section in the coding instructions. So that's actually a very handy way to get to the place that you need to be quickly. So I want to show you all what it looks like when you open up the coding instructions, and I'm going to actually go through these in just a second in a live version, but I want to show you some of the things you'll see. table of contents is set up, it looks a little bit confusing, but it's really not once you start playing with it. The table of contents, each of these main bullet points over here to the far left are going to indicate or correlate with a tab section within your Get With the Guidelines tool. Beneath that tab section, so if you see this one right here, it says a mission tab, you'll see that there are several subsection bullets that are below that. And each of these bullets are going to correlate to a section within that tab. And then to break that down even further, we're going to break it down one more step. When you click on one of these links for a subsection, it will then break it out even further into the questions that are answered within that section of the tool. And this will make a little more sense when we get into the demo and I can show you what I'm talking about. But if you have a specific question in front of you, this is the way you're going to get to it so that you can find out how to answer it. You will also notice that there are some items that are highlighted, some items that are purple, some items that are blue, and then when you get into the text of the coding instructions, there will be some areas that are green. These are all going to be coded a certain way because of how they affect your reports and Get With the Guidelines. You will notice that if it's a careted item with a single caret like this, and it's yellow, it's going to be a Joint Commission data element. If it has a dual caret and it's highlighted, it's going to be a Get With the Guidelines stroke data element. Moving forward, you will also notice there are going to be PSC core measures that are highlighted in green text. CSC core measures are going to be in purple. Coverdell, which I don't believe applies to this group, is going to be in blue. And then green highlighted text are going to be any updates. So if you see any green highlighted text, that means it's a brand new update from the TJC. And I think that's a pretty good high-level overview of how to interpret the coding instructions. From here, I actually want to jump in. I'm going to escape out of this really quick and just log in really fast to our stroke registry over here. Okay. And I'm going to go to my coding instructions. And this is where I was pulling those snapshots that were in that slide. They're at the very top of your tool.
Hey, Allison.
Yes.
Are you still sharing your screen?
Yes. Are you not able to see it?
No, it's there's a it's just grayed out. I can see your mouse moving around, but that's it.
Interesting. Now let me go back to my slide deck and tell me if you can see the slide deck. Hold on just one moment.
Okay.
If I pull this back up, are you able to see it?
Mm-hmm. Yeah.
Okay, that's very strange. Let me see if I can try one more time before we move on. We may have to improvise a little bit. How about now?
No, it's still gray.
Okay. If Michelle is on, maybe see if you can message her and see if she can troubleshoot for us. I'll move on for now, but
okay.
We may need to figure out a way to get that pulled up. Okay. And I apologize to the audience here that we are having a little bit of technical difficulty, but I will continue on. I apologize. I wanted to be able to show you all in real time what the coding instructions look like. But just to note, you can click on any of these. These are all links that are going to zoom down exactly to that point within the coding instructions. So you're not having to scroll through 300 pages of text to try to find the answer you're looking for. What I would definitely mention is that the coding instructions are going to be handy for any time you're answering a question and you're not sure what the acceptable documentation would be to answer that question. Maybe you're having confusion around like a source. Can you use nursing documentation versus physician documentation? Or perhaps you're having difficulty with finding out if a patient would be excluded from that particular data element. This is where you need to go to look for those answers. And Kristen and is always available to help as well. She can help you to navigate coding instructions. But by and large, most of the answers you'll need are going to be in the coding instructions. So always take a look before you get scared that maybe you don't know how to answer something. Just dig in a little bit on those coding instructions, and likely you'll find your answer. Okay, I'm going to move into a few other resources that you're going to notice on your homepage. If you'll look here, you've got a section that says My Hospital Characteristics. This is the place where you're going to locate any of your billing contacts. If you realize that you're getting issues around your billing, maybe perhaps you're not getting your invoice each year for Get With the Guidelines, you'll want to go in here and make sure that the contact person for your hospital is up to date. Often we find that person has either left the organization or that person has changed to a different contact within the hospital. You can also update your hospital's telestroke status, and you can indicate whether or not you're a provider or a receiver of telestroke. And since I believe Arkansas is a telestroke state, you would definitely want to indicate what your status is here. This will change how your data elements are collected. If you indicate that you're a receiver of telestroke, your form will look different than those who indicate that they're a provider of telestroke. And if anyone has confusion around what that means, just definitely get with one of us and we'll help to provide some clarity around that. You also can update your endovascular capabilities. If you are a site that is performing endovascular procedures and wants to be able to collect data around the timing of, groin puncture or first pass or, clot retrieval, any of those timing elements that are going to be important to your endovascular team, this is the place where you would do that. And this is a free update to your tool. It will automatically update as soon as you indicate that you are going to start collecting endovascular measures. You will see those pop up immediately. I would highly recommend that you do not activate this if you are not an endovascular site. Reason being is that it will add a whole bunch of data collection elements to your tool that won't apply, and it will make it difficult for you to save your stroke entries when you get to that point, because the tool will actually think that you're supposed to be entering and answering questions pertinent to endovascular, but you won't really have the need to do so. So just to reiterate, only activate this particular element if you are an endovascular site. Moving on, I'm going to also show you here in this resources box, you have a whole bunch of information at your fingertips that can be very helpful. If you're ever curious about what the award recognition criteria is, you can find that here, right down here toward the bottom. There's also a link directly to the Stroke Connection magazine. This is put out, I believe, each quarter by the American Heart Association, and it can be both digital and in print, I believe. I think it's available for order if you want to have those, maybe copies of them in your waiting rooms at your hospital or anything like that. But they can also be given out digitally if you want to just provide the link to it. And there's a lot of really great articles and survivor stories and things like that. The next thing also is to share with you this, I want to find it on here, the Get With the Guidelines Best Practice right here, Best Practices Center toward the top of the list. This is actually where we will put any best practices that hospitals have shared with us. Maybe it's routing algorithms, maybe it's order sets, maybe it's, just different things that they've utilized within their hospital to help improve the throughput of stroke patients. So if you're ever curious or looking for an example of how to formulate something for your hospital, you can definitely check here first. If not, if you don't see what you're looking for, get in touch with us, because oftentimes we can connect you with a hospital that we know of that has a really great best practice, and maybe you can even just have a phone conversation with one of them. So just to know that that's available, let us know if you need that type of help. The next part we're going to move into is the actual patient grid, and if we can get our website to show for you guys, I want to definitely show you a demo of how to enter a new patient. The patient grid is, I apologize, I'm jumping ahead of myself. Let me get back to this. First, I want to talk to you a little bit about what your initial patient population is. If you haven't started entering patients yet, this is just kind of broad information to know as far as what cases are going to be included in Get with the Guidelines stroke. And it's pretty basic information. It's probably what you would expect. We are expecting inclusion of cerebral infarctions, intracerebral hemorrhages, ischemic strokes, just if it's coded out as a generic stroke, subarachnoid hemorrhages, and then TIAs are an optional but highly recommended category that you collect. This is straight out of the coding instructions. This is under the entry criteria section of the coding instructions. This is the code list for inclusion in Get with the Guidelines, so it tells you exactly what codes you can include. And I want to just point out, too, that the ones that have an asterisk right here, TIAs and related syndromes, those are, again, I want to reiterate that they're optional populations, although highly recommended that you capture them if possible. I think there's some really great understanding about your population that can come from tracking these TIA patients. If you are able to pull them, we do realize that the data burden is a little heavier if you're tracking TIAs because there are so many of them. And that's why they are an optional population. I also want to point out that if you need more details about the individual codes that are provided within these ranges, obviously we know that there are tons and tons of codes that fall into these that are very specific. You can refer to the TJC table 8.1 and 8.2. These are found within your coding instructions, so you will have opportunity to see them within the coding instructions. However, they are so long that it was not very efficient to try to put them onto a slide. It's not very easy to read, so I did not include them for that reason. From here, I'm going to actually hand it back over to Kristen for just a moment, and she's going to talk to you all about the stroke bands for the Arkansas Forum Group. So, Kristen, if you want to jump in for just a moment.
Yes, and Allison, when I get through with the stroke bands, if you want to try sharing your screen from the top, sharing the desktop, they think that will work for the live demo.
Oh, perfect. Thank you.
Okay. On August 1st of this year, the Arkansas Department of Health implemented a statewide approach to stroke care in Arkansas using a stroke band system by building on the success of the Arkansas trauma system. Banding a suspected stroke patient will allow for linkage of pre-hospital and hospital data statewide. These bands were shipped to your hospital or EMS agency, and they are specific to your site. So if you did not receive any, or if you've run out, you need to contact Dave Rudney or Dr. Tammy Marshall at the Arkansas Department of Health to have new bands shipped to you, because those numbers on the bands are linked to your hospital or your EMS agency. So they do ask that you do not share. The stroke bands are blue in color and start with the letter S followed by 6 digits. EMS should apply the stroke band for all suspected stroke cases that test positive on a validated stroke scale. The band should remain on the patient as they transfer from one facility to the next. The hospital can remove the band if they confirm that it is not a stroke. For any patient arriving by private vehicle, or if the EMS did not put the band on, then the hospital is responsible for banding the patient. And the hospital is also responsible for inputting all stroke band IDs into the EHR and the Arkansas Stroke Registry using the Get with the Guidelines stroke patient management tool. An example of how the stroke bands work would be the patient dials 911. The local fire department EMS arrives on the scene. Patient has a positive stroke screening. Stroke band is placed on the patient and recorded by the medic. The patient arrives at a stroke-ready hospital, and the hospital records the same stroke band number in the EHR. A different EMS agency may pick up the patient to transport to a higher level of care after receiving TPA. They would also record the same stroke band number. The comprehensive center that receives the patient and records the same stroke band number in their EHR as well. The Arkansas Department of Health can now link this patient and review it as one patient instead of 4 separate cases. Allison, I can turn it back over to you.
Great. Thank you. Thank you, Kristen. Just to give you all an idea of what this looks like within the PMT, this is what you're going to see when you actually log in and start entering a patient and to get with the guidelines. On the very first page, which is the admin tab, you're going to see up here at the top that it indicates a stroke band ID be entered. This is where you're going to put that 6-digit ID following a letter S. And just to clarify too, that this is not, you are not able to enter all zeros or 6 of the same digit in this stroke band ID. So please do not enter a made up ID number. If you don't know it, just put not documented or not applicable, whichever is more appropriate. This ID number will also auto-populate in your ID band search when you are looking for, when you're on your patient grid. And what I would like to show you all, I'm getting ahead of myself again. Let me back up just a moment. In the patient grid, you're also going to see a new column added where a stroke band ID is shown that correlates to the patient ID and get with the guidelines. Again, this is so we can keep patient identifiers out of get with the guidelines, but where you can still coordinate between your get with the guidelines ID versus your stroke band ID. On your admin tab, you're also going to notice that there are fields added now for EMS interfacility transfer. These, again, are part of the Arkansas Form Group update. These are going to be available if you are both a referring or receiving hospital. So you will be able to indicate whether or not you had EMS agency that was transporting you from a referring hospital, or if you're the initial receiving hospital and what EMS agency was transporting to you as well. So here is what that would look like. You'll see EMS agency transport patient from referring hospital. It will be a drop down, and you should be able to see which EMS agency you would want to select. All of them should be loaded in there for you. You will also see here the EMS agency transport to receiving hospital. This is going to be if you are in the first hospital, to receive that patient from EMS. This is now, we're moving into just a few reminders I want to share with you all. For everyone who's got the Arkansas Form Group enabled, these 5 elements are going to have to be populated. So you will need to put the stroke band ID, the EMS agency transporting name, for the referring and the receiving, or whichever is applicable. The hospital name if the patient is transferred from your ED to another hospital. And as well, I would also need you to put the hospital name if the patient is transferred from another hospital. And this correlates to whether you're a receiving or a referring hospital. Okay. I am going to attempt to share my desktop so that we can try to enter a new patient. I want to at least show you all in a high-level way what that looks like. If you've never entered a new patient, this will be helpful for you. 2 ways to do this, and I want to just make sure we have everyone, some clarity on that. You can either do it from your home page. If you're on your home screen and you see that Get Started box at the top, if you click on the little singular patient icon right there, you will be able to enter a new patient from there. Or you can do it through the patient grid on your patient grid page. And that's actually available right here with this dual patient icon. That is where your patient grid is located. And you would see when you open that up that you have a link at the top of the screen that says enter a new patient. You could just click that and it'll open up a brand new form for you. So let me first try this since I already have it open. And I know you probably see green. Let me just double check here. Share my screen. Okay, so you're going to have to tell me. I see a green thing around my screen, so I'm hoping you all can see it.
We can see the coding instructions and now the community page.
Perfect. Okay, so we're back in business. just really quick before we move on, and while I still have you all thinking about coding instructions a little bit, I want to show you all just a couple of things. If you feel so inclined to print your coding instructions, you may do so from here. There's a link right here to print your coding instructions. I believe you can also save them as a PDF to your desktop if you'd like to from the same link. So you would just print, and it would, I believe, give you the option to save from here. Yes, you could save it straight from here. Let me go back just a second. And so when you get down here, you see what I had screenshots of in the slide deck is the table of contents. And just to kind of demonstrate, if you click on any of these, you're going to see the hospitalization tab. It's going to go straight to that hospitalization tab section within the coding instructions. And then you can look at some of the questions that are answered within that area. So you can say time of discovery, time of patient last known to be well. Let's try that one. And it's going to jump right to that section. As you can see, this is a required element. It says right here that it's required. So it's required within the PMT. It tells you to meet the definitions what you need to include. I'm going to keep going down here. And it gives you how you need to format. It tells you some notes for abstraction. This is all very helpful information to tell you what sort of data you can include in here and from whom. It's important to note that you cannot accept data from someone other than these 5 folks: neurology, the admitting physician, the ED physician, ER nurses, or EMS. So if it's anyone else plugging in that last known well, it is not an acceptable data source. So things like that are valuable to know how to find in your coding instructions. There are some examples given down here. We all know that sometimes last known well is difficult to pin down if a physician has not provided an exact time and date. So please make sure you take some time to read through these examples. It will give you a better idea of how you can, I don't want to say interpret. I don't really like to use that word with the coding instructions. We try to be very black and white. If anything, abstraction it needs to be very unbiased. And in doing so, sometimes that's hard when you are reading through patient charts if they don't follow an exact template. So if you notice you're having maybe 1 or 2 particular physicians that are consistently not providing the documentation you need, you would definitely want to follow up with them to let them know, hey, I need to have your last known well or any other data element shared in a very explicit way within your notes so that I can put it into our Get With The Guideline registry. So just some things to remember as you're pouring through these coding instructions. I won't spend a ton of time here. I'm gonna move on now to actually entering a patient. So right now, I'm going to enter a new patient through this link right here, like we demonstrated on our slide. You're going to select the Enter New Patient. And now you'll see my window is opened up to a brand new blank template. From this point, we're going to assign this patient a patient ID number. This is your Get With The Guidelines patient ID. We do not want to have the medical record number used as the patient ID. I know that could be a little bit frustrating, but we really, really, really want to avoid utilizing any patient identifiers and Get With The Guidelines. This is supposed to be a blinded resource for research, but we don't want to we just want to make sure we're not putting in detailed PHI information that can tie back to a specific patient. In doing this, though, you may want to, on your own, collect a spreadsheet or a list of some kind to track what patient ID you've assigned to a patient and what that correlates to as far as their medical record number, so that if at a later date you do want to go back and drill down on some of these patients, you would have the ability to do so and you would be able to identify which patient that was. So right here, I'm going to just go ahead and assign a patient ID. I'll use my initials and we'll pick just a vague number. And you can come up with whatever system you want to assign your patient IDs. Some hospitals are very straightforward and they just start with the number 1 and they go forward from there, so they can just have a numbering system that's, numerical in order. Some hospitals like to use a combination of numbers and letters. Some like to utilize some form of date in their numbers that they're giving so that it's easier for them to recognize when the patient came in. There's just all kinds of ways that you could determine how you want to create those patient IDs. I would just say choose something that's consistent and easy for you to understand. Stroke band ID is going to be, of course, pulled from that blue band that Kristen was talking about that is applied to the patient, and we know that that starts with the letter S, and it's going to be followed by a 6-digit code. So we'll just pick a code. From here, you're going to be in the demographics tab. This is going to be some very just straightforward general demographic information. You'll see that some of these items are bold, like gender and age, and then some of them are not bolded, and that means that they are not required. However, I would like to take this moment to get on a soapbox for myself. I think that your data is only as good as your registry is only as good as the data you put into it. So if at a later point you want to drill down on your the different types of health insurance your patients are coming in with, or if you want to be able to divide out your stroke population by race, or if you want to be able to look at them by, well, age is always going to be in there because of date of birth. But anyway, there are various ways that you can drill down on this information, and it's only helpful if you're actually entering it. So with that, I will get back to it. I want to just make sure we all are understanding that, information that you don't put in here can't be pulled out later on. So I'm just going to start with, some basic information. We're going to say that we have a male patient and that his date of birth is, we're going to say Christmas is coming up. We'll use Christmas. And he was born in 1940. I would note, too, that you do not have to put an age in. That will auto-populate for you once you save the document. And I don't know the zip codes in Arkansas, so I'm going to skip that piece. However, I would say if you want to be able to drill down on zip codes later on, it's a great thing to include. I often have hospitals ask me, well, how do I know where my patients are coming from? Well, if you're entering zip codes, it's really easy to go back and pull that out later on, and you can do some really cool analysis on where the majority of your stroke patients are coming from by zip code. Health insurance will say that he is on Medicare and that this is a white patient and not of Hispanic ethnicity. And then we're going to move on, and all you have to do for that is click on the next tab. This right here, the final clinical diagnosis related to stroke, is going to categorize the patient for you, and it's going to opt you into certain data elements moving forward. So it's really important that you select something here because it will activate certain questions that relate to that population within your PMT. So for this patient, we're going to indicate that he was an ischemic stroke. And we're going to start with the very first thing at the top of the page is the stroke etiology. We often get questions around this section. It is a little bit tricky, but it's very important information to capture if you're able to. So if it's documented in the medical record, we're going to say yes. So now you'll see that these items below have been activated. And we're going to say that this was a cryptogenic stroke. And if you don't know what cryptogenic strokes are, those are kind of a newer subsection of strokes that are strokes of unknown origin. So we're going to say that we were unable to determine based on the stroke workup what the etiology or what the root cause was of that stroke. And then we're going to keep moving. We're going to say there was no documentation of comfort measures. We did not put this patient on comfort measures only. And we're going to put the arrival date and time. So let's see. Let's use something relatively recent. We'll use November the 20th, 2018. And this patient came in at 12 noon. And admit date is also going to be 11/20. And for this instance, I'm going to say that this patient was admitted. We didn't transfer this patient out. So no patient admitted as inpatient. This is one of those tricky questions that seems like a double negative. So not admitted, we want to answer no, the patient was admitted. And I cannot tell you why that was configured that way, but it is a little bit tricky. I just want to always reiterate to folks that it's kind of the opposite of what you would think it is. And we don't need to answer this question because they were admitted. We're going to keep moving. the patient was not transferred since they were not admitted. Since they were admitted, I apologize. But if they were transferred, you'd be able to indicate to which hospital, and you'd be able to indicate for what reason were they transferred. We also want to indicate on here what the discharge date was, and we'll say this patient was discharged on 11/25/2018, and they were discharged, we'll just say 12 o'clock, just to be a round number. If this patient was transported from a receiving hospital, this is where you would want to indicate that they were transported. And then right here is where we're going to indicate what their disposition was when the patient went home. I'm going to be very optimistic and say this patient went home. But if you will notice, there's also options down here to say other healthcare facility. And when you do that, this next section is going to be activated. This is where you would indicate if they went to a SNF, a rehab facility, an LTAC, or an intermediate care facility. Now we're going to get to the clinical codes page. And there's really only one thing you're going to need to put on this codes page. We all know ICD-9s have been pretty much phased out, so that's now grayed out up here. The only code you're going to be entering is an ICD-10. So you're going to want to click on Code Finder. And up here in this ICD-10 box is where you're going to enter your code. It's important to note that you're not going to use any dashes or periods in this search box. You would just need to put the letter that corresponds to that ICD-10 code, and then the numerator as well. And I know that some of you are probably looking at this going, well, isn't I63.00 the code? In this instance, we would not want to utilize the period. So you can utilize I63.02 if you'd like. Just know that that's the format it has to be in. Then you would click search, and you'll notice that now we have that code populated right here. If I click on it, it does give me a description of what that code is. So if you notice maybe, oops, I selected the wrong one, let me change that. And you can search again. It'll pull up all the codes that are pertinent to that. So let's say we're going to choose I63032. And we're going to add that. And now it's part of our selected items. We're going to hit Save All. So this is now the code that's assigned to this patient. You would not need to worry about this section down here, the discharge diagnosis. This is all going to be optional. Now up here you have two questions under the admission tab that are going to be required elements for you to answer. And again, this is going to be questions that would determine whether or not a patient falls into a bucket for some of the measures. Most of the measures, if a patient's enrolled in a clinical trial, they would be excluded. So we want to make sure that we're not including patients that are enrolled in clinical trials. But for this instance, we're going to say no, the patient was not included in a clinical trial. And then were they admitted for the sole purpose of an elective carotid intervention? Again, we're going to say no, this was an acute event. So the patient location when stroke symptoms were discovered. This is going to be a very generic question, but it's going to tell us, did they have an out-of-hospital stroke or an in-hospital stroke? So this is going to be really important to make sure we indicate that not in a healthcare setting, it's going to be most commonly used, or perhaps if they were at like another, maybe a long-term care facility or a nursing home, or perhaps did the stroke occur after hospital arrival? This is going to be important to indicate when you have a patient where their stroke symptoms are waxing and waning. Many times we get asked a question about, what do I put as the last known normal for a patient whose stroke symptoms would resolve and then come back? You are always going to use the most recent last known normal. So if a patient's symptoms fully resolve and then come on again within, an hour or two after their arrival at the ER, that's going to be indicated as an in-hospital stroke. So you would want to make sure you're utilizing this tab right here. This option here, the stroke occurred after hospital arrival. And the reason you would be doing that is so that that patient is not counting against you in the timing measures. Many times when stroke symptoms are waxing and waning, TPA is often not given within 60 minutes of arrival because physicians would rather wait to see how the symptoms progress or if they go away. For whatever reason, maybe they're delaying TPA for that purpose. I just want to make sure people are understanding that you want to put them in the bucket that's most appropriate, and it's going to be to put them in an inpatient stroke rather than an out-of-hospital stroke. So I'm going to go back to not in a healthcare setting. And we're going to say that this patient arrived via EMS from either their home or scene. You'll notice some of these are going to be grayed out because they don't apply. This is not a transfer from another hospital, so these elements are not going to be available. Then you would get down here to EMS agency that's transporting patient to the receiving hospital. This is that element that we indicated is going to be required for all Arkansas hospitals. And for this instance, I'm going to just pick one, Arkansas Excellent Transport. That's probably not accurate, but that's okay. For this purpose, we're just doing an example. Where did the patient receive their first care at your hospital? Likely that's going to generally be the emergency department, but we do know sometimes they're going to be direct admits, especially for those transfer patients that are coming maybe straight to an ICU setting, or maybe they're going straight to the imaging suite for an endovascular procedure. Right here is going to be whether or not you got advance notification from the EMS or mobile stroke unit. And I know mobile stroke units are popping up in just different areas, so if you happen to have one in your area, this is where you would indicate that yes or no, you got advance notification. So we're going to say yes. And who all cared for this patient in the early phases? So we're going to say this patient got a stroke consult and they were in a stroke unit. And I'm going to choose Dr. Anderson here as the care physician for this instance. And then down here, you're going to see now I have a telestroke section. This is going to be important information to capture if you're a receiver of telestroke. Maybe you got that stroke consultation through telestroke. And so in this example, I'm going to use that, yes, the patient received telestroke consultation, but it was from a remotely located expert when the patient was located at your hospital. So we're going to say maybe this hospital doesn't necessarily have 24/7 stroke availability. So if the consult was performed, select the type of delivery method. So on this one, I'm going to say it was an interactive video, and then enter the date and time. So our patient came in on 11/20/2018, and we're going to say that the consultation was at approximately 12, well, it wouldn't be approximate, it would be exact, but it was at 12:25 in this case. Down here, we're going to enter some medical history information. This is a select all that apply, so I'm just going to choose some. I'm going to say this patient had AFib, they had a history of heart failure, they were a smoker, dyslipidemia, diabetes, hypertension, and they'd had a previous stroke. This patient's just a hot mess. So we're going to keep going over here and talk a little bit about what their ambulatory status was. We're going to say we're able to ambulate. And symptom duration, if they've had a TIA, that doesn't apply here. Stroke symptoms resolved at time of presentation. We're going to say no. And initial NIH stroke scale, if you have the actual NIH stroke scale documented, you would want to hit yes, enter your total score, or you can actually calculate the score. You can calculate it using the show method right here, where you can actually select the number for each of the elements of the NIH stroke scale. I just want to show you all that. I'm not going to have time to go through everything today, but it will tabulate the score down at the bottom for you. So I'm going to put the total score. We're going to say this patient had a 7 on the NIH, and we're going to say it was actual. She got it straight from the patient record. Okay, and then we're going to say down here the initial exam findings were that this patient had weakness, probably had some language disturbance, and that's all. We're going to go with that. And then ambulatory status on admission, not prior to arrival. This is on admission. And we're going to say that he was unable to ambulate, probably had some weakness. All right, so medications prior to admission. Obviously, this patient probably had some medications, so we want to make sure we're indicating what they were. Because he's a heart failure and AFib patient, he's probably on an anticoagulant. So I'm going to say he was on Pradaxa and maybe also on an aspirin. Was he on an antihypertensive? Yes. Also on a cholesterol reducer, diabetic medication. And since he's had a stroke, he probably was on an antidepressant, but we'll just select it for now. So I'm going to keep moving. Anyway, I want to show you all the patient's last time known time to be well. And let's see here. Got, we're going to say 11/20/2018. And I'm going to put their time to be well at 10 a.m., just a couple hours before arrival. And we'll say time of discovery was the same time as last known well. That doesn't always happen. Make sure you differentiate between the two. Sometimes time of discovery is after last known well, especially in instances of wake-up stroke. So just kind of make sure you put those in different buckets if it's a different situation. Brain imaging, yes, was completed. We'll say it was completed at about 10 minutes after arrival. I know I'm just being very, this is a great, perfect situation, I assume, but in a perfect world, we would get a 10-minute after arrival CT scan. We're going to say no hemorrhage found. And I want to show you this additional time tracker right here while I have you. Oops, didn't mean to click on that. I apologize. This additional time tracker, if you click this arrow right here, it'll collapse and expand. This is great if you're trying to collect data on just different components of the stroke protocol. So your time that your stroke team is activated, ED physician assessment, brain imaging ordered, so on and so forth. So you have a spot to put these times all the way through your continuum. IV thrombolytic therapy, we want to say yes, this patient got an IV thrombolytic. And let's say that it was done on the 20th, 2018 at approximately, well, not approximately, I apologize, 12, let's say 48. So 48 minutes after arrival. So we don't want to answer this question here, documented exclusions or relative exclusions for not initiating IV thrombolytic. That's not going to apply in this situation, so we're going to answer no. The patient did get thrombolytic. This also is not going to apply, so it's grayed out for us if TPA is initiated at greater than 60 minutes after hospital arrival. But I do want to point out while I'm here that if you do, for example, have a reason to not give TPA, you want to indicate, first of all, yes, but you also want to indicate what that reason was. And to do that, you have to click this Show All feature right here that you expand out, and it will give you a multitude of reasons that are considered acceptable from the label of alteplase. So you want to make sure you're indicating what reason that was for not giving it, and so that you are showing proper documentation. So I'm going to back out and put no, because we didn't have that as a reason. Again, we didn't give TPA outside of 60 minutes, so we're going to not need to select a reason. But if you did select a reason, or if you did give TPA outside of 60 minutes, you would want to indicate why. And this is also going to be required that you have documentation to support that within your patient's chart. Any reason that's selected as a hospital reason is going to not be acceptable for a reason of delay. If you're having a delay in diagnosis or in-hospital time delay due to equipment failure or anything like that, those are all going to be unacceptable reasons for delay. So we're also going to say that TPA was not given in an outside hospital. It was given in our hospital. And if you wanted to continue to answer some of these non-required elements, you certainly could. Catheter-based stroke treatment, did they go to endovascular therapy? In this instance, for time's sake, I'm going to say no. However, if they did, you would definitely want to answer yes, put the time that the MER was initiated. MER stands for mechanical endovascular reperfusion. Or if they got it out in an outside facility and then were transferred. This is where you're going to indicate whether or not they had any complications from the thrombolytic therapy. Did they have a bleed as a result of their TPA? And often this is documented generally within 36 hours. So you would want to have an NIH stroke scale score change of greater than 4 points, along with evidence of a bleed on CT or MRI. And so if you did have complications, of course, you could select that it was symptomatic hemorrhage and that you documented that. You would also come down here to indicate whether or not the patient was screened for dysphagia. And we're going to say that no, the patient was not NPU throughout the entire stay, but yes, they were screened and that they passed their dysphagia screening. and no, they were not treated for hospital-acquired pneumonia. VTE interventions, you would also want to make sure that you're indicating what your interventions were for VTE prophylaxis. This is a core measure, as you well know. Low molecular weight heparin, and we're going to say pneumatic compression pumps. And we're going to put the date here was on 11/20/2018. We started those on day 1. If you did not if you don't have anything done for interventions of a VTE prophylaxis, you would definitely want to indicate why and make sure that there's documentation of why those were not performed. But that doesn't apply in this situation, so I'm not going to answer that. For discharges on or after, if you do put the patient on one of your oral factor 10A inhibitors, your Pradaxos, your Eliquis, those type of drugs, make sure that there's documentation as to why those were given as the treatment for VTE prophylaxis, and then for what anticoagulation you're using, which exact one. And then did the patient end up with a DVT or PE? And I'm going to say no. Was an antithrombotic administered by day 2? We're going to say yes, that they were given an antiplatelet, most likely going to be aspirin in that situation. And the only thing that is required that you input on measurements, this is going to be your lab measurements, your first labs from their initial time in the hospital is going to be the LDL. So we're going to say this patient had an LDL of 120. So apparently not very well managed on their statin. We'll have to adjust that at discharge. You have the option to, of course, enter any information that's here that you'd like to if you feel so inclined. I'm going to move on now to the discharge tab. And if you see here, this will auto-populate for you. This is the guidelines of ischemic stroke estimated mortality percentage. So this patient has an estimated mortality of 2.6%. You would want to indicate here whether or not you did a modified Rankin scale at discharge. We find that this is becoming a more common practice across hospitals. So I'm going to say that, yes, the patient did have a modified Rankin, but it was an estimate from the record. We just are estimating based on the notes we saw. Let's say this patient had a modified Rankin of 2. And I believe you can see right here, you have the ability to show this, and it'll tell you what that means. So we're going to say he had a slight disability. Upon discharge. Ambulatory status, we're going to say he ambulated with assistance. All right, so now we're going to move into discharge treatments. These are going to be your medications of discharge. This is going to be really important when it comes to those discharge medication measurement requirements. So we want to say, yes, he was prescribed. He was going to be prescribed an antiplatelet. He went home on, we'll see, he went home on aspirin, probably 125, and we'll say every day. Also went home on an anticoagulant for his AFib, probably his Pradaxa, and we'll pick a dose here. Now, we don't need to worry about this because he did get the antithrombotic. Did this patient have persistent or paroxysmal AFib or A-flutter? Yes. Was it documented? And was the patient discharged on an anticoagulant? Yes. Antihypertensive treatment. This patient, we'll say he went home on a beta blocker, and he definitely went home on a statin. And we'll say he went home on Crestor. We'll say probably greater than 20. So we're going to assume right here that he got the intensive statin. He was on a statin, but his statin was not being very well, his LDL was not being very well controlled. So we upped the dose on that one. And this will autofill for you because you've already indicated that he was on an intensive statin. And we'll say not a new diagnosis of diabetes. He already had diabetes, but was definitely sent home with maybe insulin and oral agent. Anti-smoking treatment, this is going to be one of those core measures that's required for Get With the Guidelines. So we want to say yes, that he got counseling and was required or asked to maybe purchase over-the-counter nicotine replacement therapy. Yes, he was sent home on an SSRI. And then were some of these things recommended for lifestyle interventions? Reducing weight, a different diet, an antihypertensive diet, and diabetes teaching. Here is the infamous stroke education section. If you want to indicate that all items were received for core measures, you would just click this box here and it'll indicate yes for all of those core measures for you. Stroke rehabilitation, did that patient get evaluated? We want to say yes here to meet that core measure, and that the patient was referred to rehab services following discharge. Down here, this is our stroke workup section. We're going to indicate what tests were done on this patient while they were here. They probably did get a cardiac ultrasound, probably some carotid imaging. We did not do a revascularization. We did not do an extended cardiac monitoring. We did not do an implantable device. We probably did some hypercoagulability testing, probably some imaging. Oh, maybe we'll plan that post-discharge. And then short-term cardiac monitoring was probably done during the hospital, so we'll just say performed during admission. And I'm going to move over here to this optional field while I have you. And I'm actually going to flip back to my slides for just a second because in my demo it does not show you what it looks like, but I want to show you what it will look like in your view. I'm going to skip down just a few slides. Give me just one second. Okay. If you all, I apologize, we're not in the viewing format that I would prefer, but I wanted to show you this. If you see this box section here, this is the optional fields. You will notice that you've got 10 free text fields, 2 drop-down fields, and 2 date and time fields that can be utilized for any element you would like to collect beyond what is collected and get with the guidelines. This is where you have some freedom to use a little bit more customization with Get With the Guidelines. And some examples of how these are being used are provided here. This will be in your slide deck that's sent out to you. But many times hospitals are utilizing these for PI projects that are kind of hospital level that maybe they want to be able to track. And then we can show you, if you decide you want to start utilizing these, we will definitely be happy to show you how to pull them back out later on utilizing a data download. So let me flip back here to my screen. So that's what you would see when you open up your optional tab. In your measures tab, this is used to calculate whether or not you're meeting your measures. So you can hit that calculate button there, and it'll very quickly tell you all of the different Get With the Guideline measures and whether or not the patient was included in the numerator or excluded. And then if it's in green, that means you're passing the measure. So this is just a really quick way that while you're in the chart, you can still tell very quickly, am I meeting all my measures? And if not, you can go back to them really fast. Special initiatives, this is going to be one of those things that if it's turned on for you, it's a free thing to utilize. This is going to be where you can capture a lot of your information around EMS. All of those sort of really important times that you might want to know for EMS tracking. And it's great to be able to share this information with them whenever you send out your patient care summaries to EMS agencies. This historic tab I would not worry about. These are going to be for patients that are entered long before you guys are started, prior to 2011. So I would not worry about this tab. Once you get finished, this is where it's very important. Come down here to the bottom to say save and return to grid, or save and continue on form. That just means you want to save where you are and keep going, or you want to save the entire chart. You do not have to worry about indicating whether or not the status is complete or incomplete. This will not change whether or not a patient is included in a measure. So don't worry too much about this. If you want to just track it for your own purposes so you know, oh, hey, I've completed that chart, or maybe I have not completed that chart. It's just up to you how you want to utilize that. So you would want to click submit. And now it's thinking. And now we're over here to our patient grid. And these are going to be, I believe, in order of discharge. So let's find our discharge here. This patient was discharged on the 25th. Here's my patient right here, the stroke band ID that correlates with that patient. And if you ever want to get back into the patient, all you would just do is click on that discharge date, and it will open it right back up for you. So now I'm going to move back to, let's see, I think I want to go back to share application, PowerPoint. And Kristen, will you verify that you can see my screen?
Yeah. Yes, it's in. It's not in the.
It's not in the viewer. That's fine. I'll open it back up in just a second.
Okay.
Give me 1 second, guys. I lost my place here. Okay, so now I'm going to jump in. Let's see. I just want to. Does not let me. I want to see if it'll let me view from the slide, but maybe not. Okay, so we did reiterate that you can correlate the stroke band ID next to the patient ID, but I also want to show you all that you can track readmissions through this if you use the next admission hyperlink that's located beneath the patient's previous admission. And I did an example of that here where I utilized the next admission feature, and now you can see that this patient had 2 admissions, one on November the 6th and one on November the 25th. And that they have 2 different stroke band IDs for those different admissions. So I just wanted to show you that that's another way you can track your readmissions too. So navigating various tools, this is going to be where we get into our reports. And I'm just going to show you some screenshots here of what this would look like, and we'll do a quick demo in just a moment where we run a report together. But the way you would get into your reports is by utilizing this little bar graph icon on your homepage. This next screen that opens up will look just like this, and you'll have a whole bunch of different options of different kinds of reports. The one you're most likely going to live in most of the time is this configurable measure report, and that's what we're going to do our example with today. So just an anatomy lesson really quick on what our reports end up looking like when you populate them. I've kind of put the little graph, I put the little legend here for you so you can look at these. You, of course, have the title of the report at the top. A short description is located just underneath of what that measure includes. The time period is located below that. And then it also lets you know what the hospital site is. You also now down here see on the x-axis you have your time aliquots, if it's quarterly, monthly, yearly, however you've indicated that you want to pull that report out. Then on the y-axis you'll see over here is the percentage. And if you have a benchmark group, you would see it down here in the key at the bottom, and where number 7 is. And at the very bottom, oops, I apologize. Let me take a pause just for a moment. My computer is not plugged in, or it's not giving me a charge for whatever reason. I'm trying to make sure I don't lose my computer. I hope I don't lose you guys. I'm just going to keep going. At the very bottom, you have the date and time stamp for the person who ran the report. So that's important if you ever want to refer back. So again, in your configurable measure reports, you have 2 different reports that you're going to want to run quite frequently if you can to keep track of your award recognition progress. You'll have one report called the Get With the Guidelines PAA set, and then another called Get With the Guidelines Stroke Quality. So I'm going to back out into my other screen and show you all how to access those. And I should have you all in the view where you can see my PMT again. Hold on just 1 second.
We can see it.
Well, now I can't see it. That's the strange part.
Oh, no.
Now I'm having
issues. Okay.
Let me see if it'll let me do it now. I think it's because I still had the, I still had that open. So let me open up my thing real quick, and then I've got to go back up here and switch it. Just thinking about it. Here we go. Okay, so I'm going to jump over to this Reports tab, and I'm going to show you where the Configurable Measure Reports is here. So you're going to want to select Configurable Measures. And Kristen, I'm just going to let you know, my computer, for whatever reason, is not wanting to charge. Let's see. Oh, I think I know why. I figured out. Hold on just a second.
Okay.
I thought I had it plugged in. I did not. There we go. Back in business. Okay. So from here, this is a pretty simple and straightforward entry point for measures. You're going to select your time period first. So I'm going to say that we want to run a monthly report, and I want to look at the month of November because I just know for certain we have lots of patients for November. And then I'm going to run the standard measures report, this Get With the Guideline PAA set. That stands for Performance Achievement Award Set. So it's going to group together all 7 of the measures for Get With the Guidelines Award recognition. And I'm going to say that I want to look at my hospital in a bar chart format. And under here on display options, I'm going to select that I want to show similar measures on the same graph. So it doesn't give me a separate report for each measure. It's going to put them all on one graph for me. I'm also going to display the achievement goal so I can see really quick whether or not I'm meeting that measure. Okay, so now when you see this bar chart populated, you can see really quickly where you're meeting your measures and where you aren't. Each of these are going to be indicated with a color code down here, so you can see what measure is which. And now this bar chart right here has got a line that says performance achievement goal is 85%. If you're not meeting all 7 measures at 85% or higher, you would not be eligible for recognition. So now right off the bat, I can see, wow, I've got some work to do on VTE prophylaxis. That's going to be my target area for any PI project I do in my hospital because I want to make sure I'm getting that measure at least 85%. And in order to do that, I would want to drill down on what these 8 patients are. I'm going to show you all how to do that in just a moment. Now I'm going to back out and I'm going to show you the other component for those who are looking to get the plus award. If you're looking to get like a silver plus or a gold plus, you would want to make sure that you're meeting some of these quality measures. And again, I want to change my display options, but this time I want to show the plus goal and not the achievement goal. That reason is the plus goal is actually 75% instead of 85%. And in this instance, you want to show that you're meeting at least 5 of these measures at 75% or higher. So now I can count them off. 1, 2, 3, 4, 5, 6, 7 of those I'm meeting at least 75%. So I'm doing pretty good there. So now the only thing I know I need to worry about is that VTE prophylaxis from that first measure set. That's really going to keep me from getting my award. So that will be my primary focus of any PI project I need to do in my hospital, or maybe perhaps drilling down to see if I missed something in the abstraction. So now I'm going to back out since we identified that VTE prophylaxis was our target area. That's our concern. You can get to it just by that singular report right here under VTE prophylaxis, under the achievement section. It's right here. All those measures are listed for you. You can pull out just a singular report right there. But I want to change this to say patient records instead of bar chart. So now I want to be able to drill down. And we're going to generate that report. And now we can quickly pull out which patients are not meeting the measure. You can do this in 2 ways. You can actually stay in this chart right here where you are, or you can export this to Excel, whichever you're more comfortable with. In this example, because we only have 8 patients total, I'm going to stay right here in this chart and just show you. If you click on Show Filters, all of a sudden you're going to have all these filters options pop up. And how you can do this to get down to your fallout patients is to say, of the patients that were included in the results, we want to look at just only the included ones, how many were not in the numerator? So now I know I have 2 patients that did not meet the numerator in this example. So these are the patients that I want to drill down on because they are considered fallout. So that is just a quick example of how you can get down to your fallout, or drill down, so to speak. And last but not least, I want to show you all how to run a target stroke recognition. So for those of you who are interested in trying to gain target stroke honor roll or honor roll elite or elite plus, these are the measures that you're going to want to look at. So I'm going to pull up this set right here, this target stroke set, and generate that report. And there's going to be a few reports that it'll be valuable to you in this set. So first off, you'll be able to see a histogram of all the different diagnoses that you've had for that time period. You'll be able to quickly see what type of thrombolytic therapies you've initiated. And I want to indicate right here that you have the opportunity to view your TPA treatment rate at this hospital by looking at the number in the parentheses. This hospital has a phenomenal TPA rate. I would say this is probably out of the ordinary, but when you have a low volume of TPA patients, oftentimes your treatment rate will look a little higher. The national average right now, I believe, was at 11.6% the last we checked. And this is a raw number. This is TPA treated patients over the total volume of acute ischemic strokes that are presenting to your hospital. Whether or not they were even eligible for TPA, that doesn't matter. In this number, you're really just looking at TPA over total ischemic strokes. I do know there are some hospitals that are drilling down even further on that, and they're looking at total number of TPA-treated patients over the total volume of eligible acute ischemic stroke patients, so that their treatment rates are going to look a lot higher because they're looking at it in a little bit different light. Down here, you're going to scroll down and look at your first element of honor roll is to look at how often you're giving TPA in 60 minutes or less. And in this case, this hospital is giving TPA 100% of the time in 60 minutes or less, so that's fantastic. For moving more toward the honor roll elite or elite plus, you'd want to know how many times are you giving TPA in under 45 minutes. So they're only giving TPA about 25% of the time in under 45 minutes. So likely this hospital would end up with an honor roll elite award. In order to reach honor roll elite plus, you would need to reach at least 50% on your 45-minute measure. And if you ever are curious about what your average or median TPA times are, you can certainly get them down here from this thrombolytic therapy times report. And it will tell you really quickly where do most of your TPA times fall. It looks like this hospital is pretty consistently giving TPA between 41 and 60 minutes. Okay, so I'm going to back out here really quick to my slide deck. And let's see, I'm going to skip a few slides because I think we've covered some of this already. We talked a little bit about this. I think this will be handy when you get your slides sent to you to just reiterate what the different measures are for honor roll. And we talked a little bit about TPA treatment rates, and we shared what the national average is. And we talked about how to drill down. So those instructions will be in here as well when you get this actual slide deck sent to you. I did include a screenshot of what it looks like if you pull that report out into Excel. If you're an Excel person and you prefer to work in an Excel file, you would just click, oops, I apologize. You would just click this export to Excel hyperlink up here in the top when you pull out your patient records, and it would give you the option to view it in Excel like this. And while I'm here, I'm going to go ahead and hop back over out of my demo and into my screen, into my slide deck. Kristen, can you see my slides if I stay on this view? Like if I go, yes.
I can see them now, but if you want to go to view, I'm sure we can still. Yeah.
So tell me you can see them. Oh, perfect.
Yeah.
Okay, well then that makes it so much easier. I don't have to go back and forth between the two different views in WebEx. That was what was getting a little bit tricky. So I'm going to move down since we've already covered all this. Benchmarking. This is great if you're looking to benchmark yourself against other like-sized hospitals or hospitals outside of your immediate area. Or maybe you want to look at other primary stroke centers, just any way that you want to benchmark yourself. Generally, you have the ability to do so in this benchmarking section. That's all found within that configurable measure report section that we talked about. You also have the opportunity to filter your reports. If you ever want to be able to filter out some more specific information, you have different options. I've put some of them out here to the side. Filter options can include days of the week, physicians, departments, demographics, discharge disposition, arrival method, and final diagnosis. These are great when you're just trying to find a little bit more detailed information about your population. And I'm not going to run through the example, but I will say a really great way to just run this and test it out for yourself is to compare TPA time by days of the week. And why would you want to do that? Well, perhaps you want to see, do we go faster during the work week versus the weekend? Maybe you want to compare what those times look like by day of the week. Or maybe, for example, you're always slow on Wednesday. Maybe you want to find out why are we always slow on Wednesday and kind of get just to drill down a little bit further on your run of show, I guess, when you're in-house there. So anyway, that's what this report would look like when you pull it out. Each color, in this example, I've selected all the dates of the week, and then I've clicked on that compare selections box right there. And so what it will do is it'll give me a different bar for every day of the week. And that's what this would look like when you pull it out. And so now you can see how many patients met that measure of TPA time within 60 minutes for each day of the week. And on this one, it looks like, wow, we are actually a little slow on Monday. Now, why would that be? So maybe you want to drill down from there and just determine, based on this information, what can I find that in my hospital is consistent on Mondays? Maybe there's, a certain physician that always works on Monday, or maybe there's, I don't know, maybe something's always going on Monday morning, or there's a meeting or something that would slow down your ER. And that's what you can address as a stroke coordinator. You can kind of drill down from there. If you ever have a report that you've collected, maybe you've put a whole bunch of filter options and you've got some really just unique things that you're collecting using these configurable measures, you can save that selection by utilizing the Save As feature. Just give it a title and hit Save before you generate the report. And something simple that's easy for you to recognize, like in one example I gave, you can give a TPA report card to each physician if you wanted, where you can say, well, this is Dr. Smith's TPA times or Dr. So-and-so's TPA time, and you can give them that report each month. When you go back to find these reports at a later date, they're actually going to be found in the predefined measure report. So that's a little bit different section, but it's easy to get to. You would just indicate that instead of the configurable measures when you open up your report section, and you would be able to go in there and retrieve any report that you've saved. We've already talked a little bit about optional fields, so I'm not going to spend much time here. I also want to mention managing code lists. We've provided you a handout, and this will be a really great thing to keep a hold of as you go through your tool. You're going to notice that throughout with the guidelines, there's several places where there are drop-down features within there that you can capture data. If there's, say, for example, hospitals or EMS agencies that are not included on the list and you want to add them, you can do that by managing your code list. Physicians, Field 11 and Field 12 are also configurable to be whatever custom information you want to put in those drop-downs. So you will see you have a handout that's labeled how to add, edit, or delete code lists and get with the guidelines. And to do that, you're going to go on this tab up here that says My Account, and then you would see Manage Code Lists. And you'll click on that, and it'll take you to a more detailed section on where you can edit some of those different drop-down features. So I'm going to go ahead and round out our time today. And let's see, I have about 6 minutes, so I don't want to spend a whole lot of time because I want to leave a little bit of time for questions. But I want to show you all this section called, Hey, I Didn't Know That. There's a couple of things that you might find valuable. You have the additional time tracker function that I think we highlighted when we were doing our demo, but this is where you can capture some of those more minute times during your code stroke process. And to access the report function that's tied to that patient time tracker, it's located on your patient reports section in your PMT. And it will automatically run for the most 30 days if you don't enter a date for your search. Some patient resources that are built in. If you look at the very bottom of the patient data entry, you have a few resources that are located that can be populated just for that patient. These are really valuable if you're doing concurrent data entry so that you can get this to the patient before they're discharged. You have the ability to create a referral note. So say, for example, they're going to follow up with a neurologist or a PCP after. It will give them some quick information that they can take to their doctor that was collected in Get With The Guidelines. You also have the ability to tailor their stroke education. You can pull out some more specific stroke education forms that are easy to read. They're like little one-pagers. They are quick. They're kept up to date all the time. So they're they are compliant with whatever the current guidelines are. And they also are written at a grade level, I believe at a 6th grade reading level. So they are not difficult to understand. They're visually appealing. They're just a little bit easier to read than some, just black and white text on a page. So you can pull out any patient education forms that are pertinent to that patient, and you can just print them straight from your desktop here. You can say get PDF. You also have the ability to get a patient letter. If you need to send it to a physician, you can indicate the name and that you want to send it to and how to fax it. I'd also like to show you that you have the ability to pull out this really handy visual tool. This is provided by the CDC, and it indicates the risk of giving TPA within 3 hours of onset, and it shows how many patients out of 100 would wind up with normal or nearly normal, better, no major change, worse, or disabled or dead based on their risk of getting TPA. And so we always give that sort of, you have a less than 3% chance of getting any sort of disability or, major issue from TPA. But that doesn't always compute to some people. You want to make sure that you're giving them a visual representation of what their possible outcome could be due to treatment with TPA. So it shows you right off the bat, you have a much better chance of having either no change at all or a much better outcome if you take TPA. You also have, and I want to show this really quickly, I'm not going to spend a bunch of time here on these MER measures, but I want to show you the inclusion-exclusion criteria for each measure. I can tell you I get at least one question a week from hospitals of, how do I know whether or not a patient is included in a measure? And then how do I determine what data elements in the tool are actually pulling into that actual measure? You can do that by looking at these measure descriptions. And I've pulled out the one here that says achievement. So it's all the achievement measures for Get With the Guidelines stroke. And if you we'll look at the next slide, but I pulled out the statin prescribed at discharge as the example. If you click on that, it'll take you to a description. And now you've got a description of the measure there at the top. And the first thing it's going to do is outline the denominator for you. So it's going to outline who is included in the bucket for this measure and who is excluded, who is not in the bucket. And on the right, you'll see it tells you exactly which data elements out of Get With the Guidelines are going to pull that information into this measure. So if you ever have a question about, well, why is my patient being pulled into the measure? I don't understand. You can go straight here and you can quickly figure out, well, oh, I know why. It's because this patient was excluded because they were 17 years old and not 18. So you can quickly get that answer. Then for the numerator, it's going to tell you really quickly, how does it determine whether or not the patient's meeting the measure? So it's going to tell you which form is going to, it's going to tell you which data form is going to pull that information. So it's the numerator is for any patient who's discharged on a statin. And by doing that, it's finding the form element cholesterol reducing treatment. And if statin was entered, then it knows it was meeting the numerator. Okay, so I'm going to stop. I'm going to open it up now just a little bit for questions. I want to give you all a few moments to gather your thoughts. And then, Kristen, you can tell me if we have questions that have popped up that we can answer.
We just had a couple of questions. We will be providing the slides and a recording. Hopefully sometime next week we'll get that out to everyone. And then someone asked if we could print the patient fallouts, and you can do that by exporting to Excel and printing or just selecting print. I also wanted to mention, Allison, right quick before we take questions, that hopefully in March, that's the plan, we will have an in-person stroke abstractor boot camp. We're planning for 4 locations in Arkansas. It will be from 9 to 2:30 with free CEUs. And we are asking everyone to attend that possibly can, even if you're using American Data Network to pull your data out for you. We still would like for you to attend because we'll go over reports and data downloads and other things as well. So we'll send a save the date soon to everyone. And if you have any questions, you can hit *6 to come off mute.
If you also have questions still, you feel free to use the type-in box. That's fine as well, too.
We appreciate everybody taking the time to join us today for this webinar.
Absolutely. And we are available. I believe our emails are on the first page. So if you do have questions, please feel free to reach out to Kristen or myself. We are happy to help however we can. Kristen, did you want to allow a couple minutes, or we want to wrap up?
I think we'll go ahead and wrap up.
Okay.
All right.
Well,
everyone,
thank you all
have a great...
so much.
Go ahead, Allison. Sorry.
Oh, I was just saying thank you all so much, and I've enjoyed presenting to you. I, again, apologize for the technical difficulties we ran into earlier, but I do hope that we were able to give you all some tools to help you get started. And if you are a seasoned user of Get With the Guidelines, I definitely hope that you found some of this information valuable and maybe learned a new thing or two to take home. So with that, I'm going to sign off.